Since each connecting channel joins with its interiorly exteriorly related channel, example, the lungs in the large intestine, the connecting point can treat not only the channel to which it belongs, but also to its interiorly exteriorly related channel. In other words, when we use lung 7, we affect not only the lung channel, but also the large intestine channel. In fact, in this example, it is precisely for this reason that lung 7 affects the head and face, and that is through the large intestine channel. In fact, the connecting channel that departs from lung 7 goes to the thinner eminence, and this could not explain the effect of this point on the head. When a source point is used to tonify a given channel or organ, the connecting point of its interiorly exteriorly related channel can be used to strengthen the treatment. The connecting point is thus chosen as a secondary point to reinforce the action of the source point, chosen as the main point to treat the primarily affected channel. For example, in case of lung qi deficiency, we may choose to use lung channel source point, that is lung 9, and reinforce its action by using the connecting point of its interiorly exteriorly related channel, which is Li6. This technique finds its rationale in the pathway of the connecting channels, as these join up with their interiorly exteriorly related channels. This is also reflected in the fact that the symptomatology of each connecting channel often includes symptoms of its interiorly exteriorly related channel. The Great Compendium of Acupuncture by Zhen Chu Da Cheng of 1601 discusses the combination of source point with associated connecting point and calls this combination the guest-host method, the source point being the hosts and the Luo point the guest. It should be noted that the source point is the main point. That is, the choice of point is determined by the pathology of the host, that is the source point of the diseased channel. The symptoms are as follows, listing the host, which is the source point first, and guest, the connecting point second. So here we have some examples. Lung 9 and Li6 can be used for conditions where there is a feeling of oppression on the chest, hot palms, cough, swelling of the throat, dry throat, sweating, shoulder pain, pain in the breast, expectoration of phlegm, and breathlessness. Li4 together with lung 7 can be used for toothache, swollen gums, yellow eyes, dry mouth, runny nose, epistaxis, swollen throat, and shoulder pain. Spleen 3 with stomach 40 can be used to treat stiff tongue, acid reflux, vomiting, abdominal distension, feeling of heaviness, constipation, weakness, and swelling of lower limbs. Stomach 42 and spleen 4 can be used to treat abdominal distension and fullness, the feeling of oppression of the chest, epistaxis, phlegm, foot pain, and ankle pain. Heart 7 and SI7 can be used to treat heart pain, dry throat, thirst, yellow eyes, dry mouth, hot palms, palpitations, vomiting of blood, and fright. SI4 and Heart 5 can be used to treat stiff neck, swelling and pain of the throat, shoulder pain, deafness, yellow eyes, pain of the lateral side of the upper arms. Kidney 3 and bladder 58 can be used to treat dark complexion with no thirst and a desire to lie down, a decreased vision, a feeling of heat, backache, weakness of lower limbs, shortness of breath, timidity, which literally means heart and gallbladder. Bladder 64 and kidney 4 can be used to treat eye pain, neck ache, pain from neck to back to lower limbs, mania, epilepsy, opisthotonus, pain eyebrow region, pain in the eyebrow region, epistaxis, yellow eyes, contraction of tendons, and prolapse ani. Triple burner 4 and pericardium 6 can be used to treat tinnitus, deafness, swelling of throat, dry throat, swelling of eyes, earache, sweating, pain between scapulae, elbow pain, constipation, incontinence of urine, and retention of urine. Pericardium 7 and triple burner 5 can be used to treat contracture of palms, arm pain, inability to extend arm, fullness of chest, swelling of axilla, palpitations, red face, yellow eyes, laughing and crying without reason, mental restlessness, heart pain, and hot palms. Liver 3 and gallbladder 37 can be used to treat abdominal distension and hypogastric swelling in women, chest fullness, vomiting, hernia, urinary retention, or incontinence. Gallbladder 40 and liver 5 are for dull complexion, headache, eye pain, swelling of neck, goiter, hypochondrial pain, swelling and sweating of axilla. The combinations used most are described below with the relevant symptoms. Li4 and lung 7 restore the descending of lung qi, expel wind, and treat headaches. Triple burner 4 and pericardium 6 regulate the triple burner, move liver qi, and calm the mind. Spleen 3 and stomach 40 tonify the spleen and resolve phlegm. Liver 3 and gallbladder 37 brighten the eyes in the liver patterns. Bladder 64 and kidney 4 treat sciatica on affected side, kidney 4 on opposite one. So in summary, the combination of source or the Yuan points and the connecting or Luo points is mentioned in the Great Compendium of Acupuncture in 1601 as the guest-host combination. The source point is taken as the main point to treat affected channel. Example here is lung 9. Connecting point of interiorly exteriorly related channel is added to reinforce treatment. Example, Li6. Thank you for your attention.